Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not replace the actual article. And if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled, Breed Characteristic Features and Disc-Associated Vertebral Instability. Background: Cervical intervertebral disc disease, CIVDD, is a common condition affecting small breed dogs, characterized by the degeneration and herniation of intervertebral discs leading to spinal cord compression and neurological deficits. This condition has significant implications for the affected dog's quality of life and requires accurate diagnosis and effective treatment to ensure a favorable prognosis. Previous studies have primarily focused on thoracolumbar IVDD, but cervical IVDD in small breed dogs remains under-researched. Understanding breed-specific characteristics, stages of disc degeneration, and associated vertebral instability is crucial for improving clinical outcomes. This study aims to fill this gap by analyzing the clinical and diagnostic features of CIVDD in a large cohort of small breed dogs over 2 decades. Objectives: to evaluate the breed characteristic features of CIVDD, to identify the stages of intervertebral disc degeneration and associated instability, DI stages, to assess the diagnostic methods, surgical interventions, and outcomes in small breed dogs with CIVDD, to determine risk factors associated with vertebral stabilization. Methods: animals. The study reviewed medical records from 2000 to 2021 of small breed dogs diagnosed with CIVDD. Inclusion criteria included clinical signs of cervical myelopathy confirmed by imaging evidence, myelography, CT, or MRI of spinal cord compression caused by CIVDD. Exclusion criteria included dogs with spinal cord injuries resulting from major accidents. Neurological status: neurological dysfunction was classified into grades ranging from G1, cervical pain without neurological deficit, to G4, tetraplegia with or without respiratory distress. Imaging: myelography by lumbar injection was the primary diagnostic imaging modality used. Dynamic myelography was performed when primary lesions could not be confirmed or when multiple compressive lesions were present. CT and MRI were also utilized for further evaluation of the spinal cord and intervertebral discs. Stage of intervertebral disc degeneration and associated instability, DI stage. The intervertebral disc degeneration and associated instability were staged from 1 to 5, with Stage 1, no compression in the neutral position, mild disc bulging. Stage 2, compression detected in neutral or extended positions. Stage 3, clear evidence of instability with subluxation. Stage 4, dynamic compression with significant movement. Stage 5, vertebral fusion by osteophyte formation. Surgery: spinal cord decompression was performed using various surgical methods depending on the location of the lesion. Vertebral stabilization was indicated in cases of vertebral subluxation, dynamic spinal cord compression, or excessive vertebral motion. Results: population. The study included 307 dogs, with 222, 72.3%, being chondrodystrophic CD breeds and 77, 25.1%, non-chondrodystrophic, NCD, breeds. The median age of dogs at the time of diagnosis was 7 years. Findings: vertebral instabilities were identified using survey radiographs, dynamic myelography, intraoperative spinal manipulation, and follow-up surgeries in dogs with persistent post-operative paraspinal pain. Of the 307 dogs, 295, 96.1%, recovered post-surgery, with a median follow-up duration of 8.5 months. Significant differences in age, affected sites, and frequency of stabilization were noted between CD and NCD breeds. Older age and the need for frequent vertebral stabilization were more common in NCD breed dogs. Male gender, involvement of caudal cervical discs, and NCD breed status were identified as risk factors for requiring vertebral stabilization. Discussion: key insights. The study provides a comprehensive analysis of CIVDD in small breed dogs, emphasizing the importance of breed-specific characteristics in the diagnosis and treatment of this condition. The high recovery rate, 96.1%, post-surgery underscores the efficacy of surgical intervention for CIVDD. Breed-specific findings: chondrodystrophic, CD breeds, such as dachshunds and beagles, showed higher susceptibility to cervical disc herniation compared to non-chondrodystrophic, NCD, breeds. CD breeds often presented with multiple affected disc sites, necessitating dynamic myelography and potentially multiple surgical interventions. Vertebral instability. The study highlights the significance of diagnosing and managing vertebral instability in small breed dogs with CIVDD. Vertebral stabilization was crucial for dogs with subluxation or dynamic spinal cord compression, and the staged approach to DI provided a structured framework for treatment decisions. Surgical outcomes. The high success rate of surgical interventions indicates the effectiveness of decompression and stabilization techniques. This study recommends vertebral stabilization in cases of detected instability to prevent recurrence and ensure long-term recovery. Future directions. Further research is needed to refine the diagnostic criteria for vertebral instability and to develop less invasive surgical techniques. Long-term follow-up studies could provide more insights into the prognosis and quality of life of dogs post-surgery. References. The study cites previous works that have contributed to understanding CIVDD and vertebral instability in dogs, including key studies on spinal cord compression, myelography, and surgical outcomes in veterinary neurology. This concludes our detailed presentation on the article. Thank you for listening.